Alcohol, being the progressive disease that it is, really started to take its toll.
It got scary. I would go pick up my daughter at carpool and I would have drinks in my car.
I was, just driven by alcohol and drugs to my whole day was just depending on, how I'm gonna get my next drink or how I'm gonna get my next hit.
The last night of my bottoming out, here was my wonderful 23-year-old son who had stayed away from drugs and alcohol, and I'm trying to pick a fight with him.
But I just grew really sick of being sick, and I would tell myself I wasn't going to drink, and then I would.
It destroyed my marriage. It destroyed countless jobs. I lost countless jobs due to my addiction.
Yeah, I'd had a lot of remorseful mornings, but none as bad as that one.
There is a way out. There is a way to recover.
I had to have help, or I wasn't going to live.
Things starting to turn around tremendously once I found CDAP.
This program saved my life.
It's just amazing.
The Center for Drug and Alcohol Programs is housed within the Department of Psychiatry at the Medical University of South Carolina, and it's a world-class research and clinical program. Our researchers, both clinical and basic, work side by side to better understand the reasons why people become addicted. Our mission is to combat addiction, and in particular alcohol dependence, through research, education, clinical care, and community outreach.
The Charleston Alcohol Research Center, since its inception in 1995, has embraced a translational research approach, which means that it focuses on studying changes in the brain that result from alcohol exposure and how this can lead to the development of new treatments. And we use a number of state-of-the-art technologies and tools that are critical for us understanding how alcohol alters the brain. And one of these is brain imaging, which enables us to be able to examine how an individual is responding to alcohol, and in particular how the brain gets activated, what parts of the brain get activated when an individual is exposed to alcohol or even cues of alcohol.
So we take the world-class research that we're doing at CDAP at MUSC in Charleston, looking at treatments for alcoholism, and we share that information with teenagers through college, to medical school, into their psychiatric training, and ultimately into becoming addiction psychiatrists. My job is to share with the patients and share with my trainees the knowledge that we have developed through research at CDAP to help improve people's lives.
We want people to better understand the risks that are involved in using alcohol and drugs so they can make better choices, healthier choices. And each year we talk to thousands of children and parents and teachers about the biological effects of alcohol use on the teenage brain. The adolescent brain isn't fully developed yet, and so chances of becoming addicted can be hardwired when using drugs and alcohol at an early age. So my mission is to help people better understand that this is a disease, a chronic relapsing disease of the brain, and we want people to understand that so we can advance research and reduce stigma and help people make better and healthier choices.
The research findings within the area of addiction gets translated here in our clinic. And this is where we do assessments and carry on psychotherapies to help people and their families. I am in awe of a lot of our patients. It takes so much courage to take that first step to actually seek help and to admit that you have a problem. Every day here is so rewarding. It has its ups and downs, and some days are extremely challenging when you watch patients struggle. But at the same time, when you have a patient come back and tell you that, Dr. Majid, hey, you want to say congratulations? Today's my 12th-month sobriety anniversary. Those kind of sessions, they bring tears to your eyes, and that's when you get to just sit back and say, well, keep doing what you're doing.
visibility is improved, when there are funds to support continued public awareness and especially support research.
The money isn't going to Washington, D.C. and being, feted away. It's here, it's the outreach here.
And CDAP is a national leader in this country and consequently is very visible around the world.
The disease of alcoholism is the #1 driver of healthcare costs in our society and has been for the past 20, 30 years.
When people make donations or step forward, it brings reality to that specific disorder and it makes it more like an illness than anything else.
The government's giving less and less grants. We need more support from the community.
We've got progress yet to make, and that's one of the reasons that we look for people who can help us both financially and help us by coming forward and helping diminish the stigma associated with it.
I think a huge reason to support the CDAP program at MUSC is you're helping the community. Your support of this program isn't just helping that individual, it's helping their family, it's helping all their other relatives, it's helping their job association.
It restores people, back to society. It restores people back to their families. It restores people back to themselves.
The growth that happens to you is so magnificent.
You're doing a wonderful thing by contributing to this program because you're helping a lot more than just the individual person.
I could never be the way I was before, thanks to you.
Please join me in supporting CDAP.
Please join me in supporting CDAP.
Please join me in supporting CDAP.
Would I choose change my mind and change